Hello, I am Nurse Joe, and today I've got information on antianginal drugs.
So what is angina? Angina is chest pain that is caused by poor blood supply to the heart as a result of atherosclerosis. There are 5 types of angina: stable angina, unstable angina, vasospastic angina, microvascular angina, and atypical angina. What are antianginal drugs? They are used to manage chest pain associated with ischemic heart disease by increasing blood flow and oxygen supply to the heart, or decreasing oxygen demand by the heart, or both. What is antianginal drug therapy? It reduces the frequency, duration, and intensity of the pain, as well as improves the client's ability to carry out their activities of daily living with as few adverse effects as possible. It also helps to prevent or delay a heart attack. Nursing assessment. It is important for us to know the patient's health history, as that helps us determine if there are any contraindications to the antianginal medications. It is also important to note their liver and kidney function to know how their metabolism and excretion of the drug will be affected. Take note of their current use of other medications such as over-the-counter medications, prescriptions, herbal supplements, and vitamins. Also take note that cross-tolerance may develop when nitrite and nitrates are taken simultaneously. Ask patients about their symptoms of their chest pain, such as dizziness, lightheadedness, syncope, etc. Also be sure to ask the patient about the location, duration, intensity, and other factors causing the pain. This is because nurses are able to determine a suitable therapy for the patient using this information. Assess vital signs to gain a baseline on their respiratory patterns and rate, blood pressure, orthostatic blood pressure, and their pulse, and make sure to monitor their blood pressure and pulse throughout the therapy.
Nursing diagnosis. Is the patient experiencing any pain caused by the lack of blood supply to the heart? Is the patient experiencing any physical immobility caused by chest pain? Cardiac output should be decreased as a result of coronary artery disease. Coronary artery disease can also cause a decrease in tissue perfusion. Does the patient have sufficient knowledge about the use of antianginal drugs for their condition? Patients may be at risk for injuries when taking this drug because of adverse events. And now, nursing intervention. Advise patients to report bradycardia, dizziness, confusion, depression, or fever. Do not use over-the-counter medications in conjunction with therapy unless directed by the physician. Obtain a heart rate reading before the administration of any antianginal drugs. If heart rate is less or equal to 60 beats per minute, do not administer the medication. Consult a healthcare professional. Encourage patients to control their weight, make dietary changes, and participate in exercise programs. Advise patients to reposition slowly to prevent fainting. So after nursing intervention, you have to evaluate. Monitor for therapeutic effects, such as the relief of angina and decreased blood pressure, increased level of comfort with fewer precipitating events, increased tolerance for activity. Report to the physician if you are experiencing any signs and symptoms of an allergic reaction, such as difficulty breathing, swelling of the face, hives, etc., or adverse reactions, such as headaches, lightheadedness, decreased blood pressure, dizziness, nausea, edema, drowsiness, rash, dysrhythmias, fatigue, and postural hypertension. And now to SEMA for amlodipine mesylate.